mentioned food, Dr. Cohen. What is, I guess, what are the one or two key studies around food, and what is one change you hope patients can make if if you had to pick one as far as their diet and impact on cancer risk?
Well, a really exciting study, thinking more currently, is one that we published at the end of 2021. So just a year ago, in the journal Science, that showed clearly in a cohort of our melanoma patients that those who were eating a high fiber diet had a much higher probability of responding to immunotherapy. So these were all melanoma patients with advanced disease about to start immunotherapy, and we assessed what their standard diet had been. So some will say, well, that's, there's all these other behaviors. We did somewhat control for those, but then we took that into the animals and clearly showed that in multiple animal models from multiple laboratories, that animals that ate the high fiber diet had a much higher chance of responding to immunotherapy. Equally, those who were consuming a probiotic had a decreased chance of responding. So we think, what this is all about, and we haven't talked about yet, is the microbiome and making the microbiome as healthy as possible. The microbiome are the bacteria, the organisms that live on and in us, and the majority of them are in our intestinal tract, in our gut. And we have been able to show in multiple laboratories actually around the world that the quote unquote health of the microbiome will influence whether you get cancer and will influence treatment response after a diagnosis. And there's a lot of research trying to figure out, what are the healthy bacteria, what are the unhealthy bacteria? Ideally, how can you put this into a pill? And to date, that work hasn't been super successful. And what we know is the healthiest way to maintain a healthy gut is to eat a high fiber diet, in particular soluble fiber, which comes from the plant world. It comes from plant-based eating, is a high fiber, high soluble fiber diet, which is going to feed in particular the healthy bacteria that already is in the gut, that has, again, evolutionarily speaking, has evolved with us over time. And the flip side of that is red meat, sugar, high saturated fat foods. These food groups feed the unhealthy bacteria that are in our gut and allow them to proliferate. And ultimately, the key is to create diversity of the healthy bacteria. And there's been some studies showing that eating judicious amounts also alongside a high fiber diet of fermented foods, which have healthy bacteria in them, like yogurt, sauerkraut, kimchi, miso, although, and I say judicious amounts because if you eat too much of those fermented foods, then you're getting a limited amount of bacterial strain. So, the take home here in the area of diet, as we talked about earlier, is to eat a diet that's plant-centered, not to the exclusion of animal products for those who want to eat some meat or other animal products, but to have that be a very small portion of the diet, making sure that the fats are from healthy sources like nuts and avocado, and ideally not highly processed oils like grapeseed oil, olive oil are healthy oils. Essentially, they aren't highly processed. They're essentially just crushed and the oil is extracted. Low glycemic load, and what that, a different way of phrasing that is is low sugar. We know for sure in multiple studies that processed sugars increase inflammation, have a negative impact on the immune system. So that's not just refined white sugar, but trying to decrease foods that lead to a spike in glucose, which then needs to have a commensurate increase in insulin to be able to balance our system. And it's that spike in insulin that will also lead to inflammation. And inflammation is kind of a backbone of what stimulates multiple cancers. And high fiber. So whole plant-centered, high fiber, low sugar, low glycemic load.